Well, you know what? There's some senior health care available in the area, and many, many thousands of folks just don't even know of its existence. And Senior Whole Health, it's part of the state's SCO, Senior Care Options Program, that offers comprehensive care for individuals 65 and older on both Medicare and Medicaid. And again, thousands of folks within our listening range right now just don't even know that this help is available to them. Joining us on the line right now is Deb Daviau. Daviau, am I pronouncing that correct, Daviau?
That is correct, Daviau.
Daviau. Okay, Deb, thanks for your time. We appreciate it. And Deb is here to represent the Senior Whole Health Program. And tell us about this. Obviously, this is a very difficult time for many folks with budget cuts, both on the state and federal level. And if there's help out there, these folks need to know about it. What is available?
Well, absolutely. Thank you so much for having me. And, basically, Senior Whole Health, as you said, is a SCO plan. And to be eligible, you have to be age 65 or older, have Mass Health Standard, and live in our service area. Right now, the Senior Whole Health is a health plan that replaces Medicare and Medicaid and the Part D prescription plan. And it is available and has been available since 2004, and it's amazing the amount of people who don't know about our program. It's very easy to join. We do have an 800 number that people can call if they're eligible, and we would be more than happy to, get them set up. The number is 888-566-3526. And basically, the way that we are structured, we have... as I said, we're a health plan, and so the person would choose their primary care doctor, and we would work with that doctor to come up with an individual care plan. So it's based on the needs identified in a home assessment of that individual member that is developed with the primary care doctor and the ASAPs in the area. It's very flexible in covered benefits. So we do cover health care, but we also have a lot of home care services that we work with our community people with, and we can tailor it to a member's specific needs.
Now, you said this replaces Medicare and Medicaid?
Yes, and it's a voluntary program that they join. So basically what we tell people is just take your Medicare and Medicaid and your Part D prescription cards, which there are 3, and put those to sleep in your drawer, and then you join Senior Whole Health, and you have one card. So it's very administratively simple, and I think that what happens with a lot of our seniors is that there's such fragmentation in the healthcare system right now where they're not sure whether they're supposed to use their Medicare card or their Medicaid card. And with Senior Whole Health, we help them navigate through the healthcare system. They have one card, one person to call. We have a great CRC department, which is our member services department, and they're linked with our clinical team so that if there was ever anything that needed to be handled with that member, there is help right within reach with one phone call. So
there's no need for supplemental plans or anything with this?
No, not at all. And as a matter of fact, what's very important to also note is that there are no costs to this program. There's no copays, there's no deductibles, no coinsurance, and there's no copays on prescriptions. And I think that's a very important point because you do have that under some plans. So, our typical member is on, anywhere from 5 to 7 prescriptions, paying, anywhere from $2 to $5 a month for their medications. And with Senior Whole Health, there is no cost whatsoever for prescriptions. There's zero copay.
This is a program that is designed by the state. So, this isn't some fly-by-night operation. This is actually the government that put this together.
That's correct. We were basically started in 2004 as a demonstration plan by the state. And so it is approved by the state. We follow all the state and federal regulations. We are, in fact, an approved Massachusetts health plan.
And this is something that's income eligible, or how do you find out if you're eligible?
Well, if the person is on Mass Health Standard, then they would be eligible. And Mass Health Standard is, in fact, by virtue of income. So if somebody is on Mass Health Standard, then they would be eligible. And if they're not sure, they can call us and we can help them navigate through that.
And then this is compatible with all the local hospitals as well.
Yeah, yes, our network in the Fall River area is very extensive. As a matter of fact, our first member was brought in Fall River back in 2004, and we currently have about 7,500 members on our plan, and about 2,100 of those are in the Fall River area. Very robust network, all of the primary physicians and hospitals in the area.
Excellent. Give that number one more time, Deb, for folks who might want to call.
Thank you very much. The number is, again, 888-566-3526.
Deb, we appreciate your time and the valuable information today.
Thank you very much.
Thank you.
Bye-bye.
All right, some valuable information for you folks out there who might be in need of some relief from the health care you're on. And